14th of November 1980 was the day of my inspiration. I had my first acupuncture treatment and it was for a back injury, and I walked in like a crab and walked out of there upright, still in a bit of pain, but I thought, this is perfect. I love this acupuncture. I need to know what it's all about. So that's what inspired my entry into Chinese medicine.
And how?
I've been practicing Chinese medicine now for close to 21 years. I think the whole lot started about 1994. By myself.
By yourself?
Yeah. From home, it was just a mobile practice. But when I actually had an established practice, I moved in with another buddy of mine from college, and he had brought into an acupuncture practice and he wanted a female practitioner to work with him. So I actually went in there on a Friday and he worked the rest of the week, and there was also a naturopath in the clinic at the time. Purely personal. For some people, they really like having other people with them. Other people are lone wolves, they like to do it on their own. So it's what works for you best. There's no set standard. Everyone will do what they need to do to get the best out of themselves. So there's no set prescription. And what might work for you at the beginning may not work for you later on down the track. So everything's absolutely dynamic and changeable, just like qi is in Chinese medicine. Things I needed to start in practice all of those years ago were quite different to what is needed now, because now there's Chinese Medicine Board registration that we need to have before we can practice, now that we're nationally registered. But way back then, probably the most important thing I thought was a professional association membership, and I had been a student member of the Australian Acupuncture and Chinese Medicine Association, and then that just translated into, or transferred into, proper membership or full membership when I graduated, and that gave me health fund provider status, which is extraordinarily good, because then you've got an open door. People tend to have extras cover. It's very rare that you have a patient without extras cover. So having that security of provider status is really immeasurable. So I think that's one of the best things, and you get that by being in a professional association. And AACMA is definitely the one, the peer association that's been going for 42 years, so you go with the best. Then the other things that you require definitely are professional indemnity insurance. It's difficult to practice, and it's part of the CMBA requirements. You definitely need first aid qualifications as well. They're mandatory. You can't practice without them. And then there's the day-to-day stuff. You need a table, you need needles, you need herbs if you've got Chinese herbal medicine qualifications, but you needn't necessarily have herbs. You need a phone, you need a receipt book, and you need an appointment book. Very important. Some people have online appointments, works for some. I choose not to have that. But they're just the basics. But then definitely a decent, affordable location. And that means that it's a location that maybe there's not too many other practitioners around you, so you've got a ready-made market. That's just my advice. Whether it's, some people will go, yeah, that makes absolute sense, and they may not have necessarily considered that as part of what they needed to do. They'll just go, yep, this looks like a shop, it's good, I'll set up here, and there's 5 other practitioners around them, so what are they going to offer that's different to the 5 other practitioners around them? That could be part of the marketing that they need to look at. But really, more than anything else too, you've got to know your staff, and you've got to have good skills. People won't come back. Doesn't matter how much you know, if you don't impart that in the practice that you're running, it's just not going to happen for you. No, I don't specialise. I really like a general practice. I do a lot of fertility treatments. I do a lot of paediatric treatments. I do a lot of musculoskeletal. I really like doing pain treatments. I really enjoy mental and emotional disorders. There's a lot of stuff. I like all of them. Each one of them is really I just love it. That's it. I just love it. No one of them is any better than the other. Every person is as important and unique at the time when you're seeing them. So that's what you're in. You're investing in that, because they won't come back if you're no good. If you're a dud, well, I wouldn't come to me if I was a dud, so I don't expect other people to. So you've got to back yourself and know stuff, and impart it and apply it. I don't think that they've necessarily changed. I think my knowledge continues to improve, so that knowledge then will fuse into the treatment and make it perhaps a better treatment. But really, unless I'm happy for that patient to get off the table, they're not going to get off the table. I mean, if I'm not happy, they're not going to be happy. So I guess, I don't know, that one I can't answer properly. Has it changed? No, I still will give it the best I can. I have gone and spoken at the diabetes group at Prince Charles Hospital. I have gone and spoken to the Return Service Women's League and talked to them about ageing medicine. I've gone and spoken to View Club. I've gone and done all of those kinds of things, but it doesn't necessarily get you patients to come. I haven't done a letterbox drop. It's purely been word of mouth. And without necessarily being arrogant or anything about it, if you do a good job, people come. And I know when I was only working one day, the first day I started work in that practice, on the 1 day a week, I had 3 people. The next week I had 7 people. The next week I had 10 people, and it just continued to grow. And then in 2 days and 3 hours on a Wednesday night, I was treating up to 30 people roughly, and that took 3 weeks to get that. So I've never really necessarily had a challenge to market myself, because people, it's word of mouth. Word of mouth. I think in all of those years I've had 3 referrals from Yellow Pages. Otherwise everyone else has been purely word of mouth. I don't get it any other way. So I've never advertised anywhere or done anything, and I don't even have the Yellow Pages advertising except the one line for the phone book now, because it's pointless. It's a waste of money. So I'm not very helpful as far as marketing necessarily, but I think for new and beginning practitioners, depending on the market they want to chase, maybe they go and visit their local sports clubs. If they're trying to do the sports medicine and musculoskeletal stuff, if that's their particular bent that they really enjoy, that's what they should go and do. Make themselves known there, and perhaps just treat one of those players. And if they do a really good job there, that player will definitely go and tell everyone else, and then they'll bring people there. If you're interested in fertility, well then perhaps go and visit the local obstetricians, gynecologists or fertility clinic in your area. Make it known that you've done this kind of thing and that's where your interest is. So it's finding the market that you want to tap into, and then making something up, like a really nice little flyer that you can give to them that's really easy for them to read, and there's a decent line there that says, yep, fertility, specialise in that, gone and studied in China or done extra studies in Australia, and that way you'll get credence with these people. Once you've got that credibility, people will come to you. So that's probably my best advice in marketing.
Girl, I say, if only